Following the news this week of what appears to have been the first confirmed case of a COVID-19 reinfection, other researchers have been coming forward with their own reports. In this video, we will address how COVID-19 reinfection works and its implications. In the case of a 25-year-old man from Reno, experts were afraid because his second period while contacting COVID-19 was more serious than his first. The Reno resident in question first tested positive for SARS-CoV-2 in April, after coming down with a sore throat, cough, and headache, as well as nausea and diarrhea. He got better over time, but later tested negative twice. But then, some 48 days later, the man started to experience headaches, cough, and other symptoms again. Eventually, he became so sick that he had to be hospitalized and was found to have pneumonia. Researchers sequenced virus samples from both of his infections and found they were different, providing evidence that this was a new infection distinct from the first. Despite what happened to the man in Nevada, researchers are stressing this is not a situation that should be too alarming or one that should result in firm conclusions. As this is a singular finding, this does not provide any information to researchers with regard to the generalizability of this phenomenon. It may be possible that these early cases of reinfection are outliers and have features that won't apply to the tens of millions of other people who have already shaken off COVID-19. Researchers have always presumed people would become vulnerable to COVID-19 again sometime after recovering from an initial case, based on how immune systems respond to other respiratory viruses, including other coronaviruses. Generally, people who get COVID-19 develop a healthy immune response, replete with both antibodies, molecules that can block pathogens from infecting cells, and T cells, which help wipe out the virus. This is what happens after other viral infections. In this case, after the researchers analyzed the genomes of the coronaviruses from both times he was infected, they found that the viruses had differences in some of their genes caused by natural mutations. The findings strongly suggested that the patient was infected twice with two slightly different versions of the coronavirus rather than having a prolonged infection with a single virus. In addition to fending off the virus the first time, the immune response also created memories of the virus should it try to invade a second time. It's thought then that people recovering from COVID-19 will typically be protected from another case for some amount of time. With other coronaviruses, protection is thought to last for perhaps a little less than a year to about 3 years, but researchers can't tell how long immunity will last with a new pathogen like coronavirus until people start getting reinfected. They also don't know exactly what mechanisms provide protection against COVID-19, nor do they know what levels of antibodies or T cells are required to signal that someone is protected through a blood test. In cases of other respiratory pathogens, our immune systems might not always be able to halt infection entirely, but could still put up enough of a fight to guard us from getting really sick. Ultimately, infections and the immune responses they induce among people are heterogeneous and are bound to produce different results in different people. What is of most importance is figuring out if reinfected people can transmit the virus to others. This may have to wait and see moment for many of us until researchers find conclusive evidence. Modelers are starting to factor the possibility of becoming susceptible to the virus again into their forecast. If reinfection is possible on such a short timeline, there may be implications for the efficacy of vaccines developed to fight the disease. It may also have implications for herd immunity. Herd immunity is a form of indirect protection from infectious disease that occurs when a sufficient percentage of a population has become immune to infection, whether through vaccination or previous infections. This would thereby reduce the likelihood of infection for individuals who lack immunity. After patients recover from COVID-19, enough is not known how much immunity is built up, how long it may last, or how well antibodies play a role in protection against a reinfection. Thank you for following along with our video. We hope you may use this video to be educated on COVID-19 reinfection.